And but by doing that, it gets a bigger age reflex. So
did they mention anything about what behaviours they were?
yeah, no, it works. But
No, they're just
that's the
really
way
conditioning the behavior, not the age
Really?
reflex. So it's hard to know which one.
Yeah,
The rat
this is
is-
hard.
yeah.
Because maybe you condition both. You know, you change your age reflex and that's where you change your behavior. And I don't know. But, okay.
Maybe those behavior and the age reflex size,
They
they
go
coincide.
Together.
Yeah, they go together.
But they don't mention any note. They don't note any specific behaviours that the rats perform.
No, not that.
Because that would be important, because if they notice that at least the rat is always turning or doing
Mhm.
something, when they have to realize there is some kind of association. But the rat must be doing something if this is 1,000 times a day.
Yeah.
Maybe, yeah.
Maybe each rat has different strategy.
Yeah.
So after the conditioning, the left leg stance is at the right place. So that signifies that the symmetry is improved. What about humans? Same group in 2009 looked at healthy subjects and showed that over 24 conditioning sessions, age reflex size is increased in the up conditioning and decreased in the down conditioning. The filled triangles represent the subjects in whom their conditioning was successful. And this data from the down conditioning will be used in the paper that I'm presenting actually. Another finding, major finding from this experiment was that age reflex has two components: task-dependent adaptation, the short-term component, and the long-term component, long-term change. And this terminology will be used later in the paper I'm presenting. So the paper,
So,
Yeah.
Karen, I'm thinking in your study, so some of them after 24 sessions is 10%. I mean, there's people with 20% increase.
Yeah.
I mean, it's really two people who went to 180, but after 24 sessions.
Yeah. It's not a big change.
I'm thinking about what you showed me.
Yeah.
You know, I mean, maybe to induce changes after a single session is not, you can induce root plasticity, but then to elicit a longer
Well, that's what
change.
so after a single session you're probably doing task-dependent adaptation.
yes.
Whereas
Yes.
whereas for the long-term change you'd have to do the whatever 20 sessions. So presumably the task-dependent adaptation would wash off the day after or a couple of days after or whatever.
If you didn't continue.
Yeah.
Yeah. Wash out. Yeah.
Okay.
I mean, they also, they show like that plateau years later. Like this week, I've kind of seen that a little bit, and after the 5 days, it seems to was, well, it was, I guess we were saying physiology, so we don't know. Yeah, I don't know.
But it's 20%. Do you know this
Yeah.
group, when they do after one session, do they see improvements or they need several sessions to see improvement?
This thing,
I think there is 6. 6, yeah.
The first
Six.
yeah,
Six sessions.
to show.
Sessions.
Yeah, actually I asked them, so how many sessions required to see
Yeah.
a significant difference? They didn't know. So.
Okay.
I mean,
It says 6 sessions.
the conditioning, it starts to go down after, about session 6. And it's about session 5, session 6, but then it just sort of plateaus. The overall effect just kind of stays the same, and actually gets kind of worse towards the end, towards session 24, 30.
Yes, they do a result and they increase and they plateau also.
Yeah.
They don't seem to keep
Yeah.
increasing, yes. So it's similar.
So this paper was the first time they looked at this protocol in people with spinal cord injuries, and they asked whether people with spinal cord injuries would also be responsive to this protocol. So if they will decrease their age reflex, soleus age reflex size, and whether it would be associated with improved locomotion. They had 13 ambulatory subjects who had different post-injury intervals from 8 months to 50 years. And the subjects were divided into two groups, down conditioning group and unconditioned group, DC and UC respectively. There were 9 subjects in DC group and 4 in UC group. They were asked to maintain a stable standing posture with their hands resting on the bar around the level of their waist, and maintain stable background EMG activity in soleus and TA muscle. Also, they were monitoring their M wave size and M max, so making sure it's constant. Subjects had to maintain stable activity of a specific range for 2 seconds in order to get the stimulus. And the minimum interstimulus interval was 5 seconds, but it varied greatly because subjects were allowed to sit and take rest. Stimulus intensity was 0.2 to 2.5 milliamperes. Looking at the subject level of injury, they had, in DC group, they had 5 cervical and 4 thoracic patients. And in UC group, they had 3 cervical and 1 thoracic patient. So I think they should have increased the UC group size and also maybe make it more diverse, right? It's like 75%. So I emailed ICO about the people who didn't respond, the way you told me, and she didn't get back to me, unfortunately.
Yes, she just had a baby.
Yeah. So we don't know about that. But the subjects were given visual feedback. And all of the subjects were given the feedback about their background EMG activity. That's over here. There were 2 types of trials.
Was only the feedback for the soleus or for the TAs?
I think for both. Because it's been saying, it was said that stable background EMG activity in those 2. So I think it was summarized and given for that. Double check that. There were 2 types of trials, control trials and condition trials. Control trials had only background EMG activity, and in condition trials, the subjects were asked to decrease their H reflex, and they were given feedback whether they were successful in it or not. Here, the blue bar represents the average H reflex size for the baseline sessions, and if they were successful, the green bar would pop up, and if they were not, the red bar would pop up. As for shaded area, it was the criteria which would count as a successful criteria for successful level for downsizing their H reflex. So I looked at the papers, whether they explained by how many % they should have decreased their H reflex, and there was nothing about it. And actually, it's really weird how they defined the criteria. So I read it over and over, and I went to the initial paper that they have a reference to, and it's still unclear to me. The criterion was selected so that if H reflex values for the new block were similar to those for the previous block, 50 to 60% of the trials would be successful. The papers.
So they did that so they could tell whether they were having an effect by chance or not, I think. So if you tell some, if they're randomly changing their H reflex, you'd expect them to get it in the right direction, just by chance, up to about 50%.
Oh.
So if they go above 60 or 65%, then that's that's significantly more